Welcome back to this channel. I'm going to talk about a thing that I promised in my other video, that I'm going to talk about normal tension glaucoma. As the name tells you immediately that there is something normal in this. But the name has three parts. The name of this condition has three parts. Normal, okay? Tension, there's some tension going on. Glaucoma, bad word, really bad word, really bad word, okay? Normal tension glaucoma is a dangerous thing. Why? It's just like a hypocrisy. The hypocrisy or hypocrite are very dangerous people. Why? They will sound just like you. They will sound like your friends, but they are not your friends. They are your enemies. Just like that. This specific type of glaucoma is like a hypocritic glaucoma. It's like a hypocritic condition. You are easily tricked. Even eye doctors are tricked. I am shocked to find out sometimes that, oh my God, my patient, I am seeing him today, but he saw another eye doctor like a year or two ago, and he wasn't labeled as anything like glaucoma, and now I have to tell this patient that you have something called normal tension glaucoma. So even sometimes eye doctors can miss it. It's such a hypocritic condition that you will be faked. You will be bluffed by this condition that, oh no, my patient has nothing. But eventually you will find out, this patient has got normal tension glaucoma, and the doctor is going to tell you that bad news. Why is it called normal? It's called normal because of tension or the pressure or the hemodynamics of the eye being normal. That's why it fakes us. It is very hard sometimes to label a person with this condition called normal tension glaucoma because the eye pressure is normal. That's the biggest thing we do on every single eye exam, on every single patient, that we are screening them for the intraocular pressure. The pressure is normal. The patient is asymptomatic. He had nothing in the history. He had nothing in the exam. And the angle is also normal. The damage is found at the optic nerve, okay? And I explained this baseline concept, that how or what causes glaucoma, in my other video. Please check that out, okay? So yes, the patient is asymptomatic. The patient has no complaints. The patient has normal pressure in the eye. The patient is there with 20/20 vision, but you find out that the optic nerve within your eye is actually damaged. That's a bad news. You need to break it to the patient and you tell them, then the patient sometimes won't even believe you. They will want to go to some other eye doctor for the confirmation. But my job is to tell them, no matter what it is, I have to be truthful. Because if I'm not being truthful, I'm being a liar to my own profession, to my own patients, and I consider that as a crime. So constant monitoring is what you need for those patients. They need further testing. You need to prove yourself to the patient. You need to prove yourself to the insurance. You need to prove yourself even to the referring doctor. Yeah, this patient is going to get further testing. OCT is my favorite, but you also do visual field. You do those testing, and then you treat accordingly, because you have to look at the pressure, you have to set the target pressure, you have to set the target nerve fiber layer things, that you look at the scan and you don't want it to progress with that damage, and you have to stage it accordingly, that what stage am I at, what's the age of that patient at the time of diagnosis, and what sort of drops do I need to give, and things like that. So it depends on patient to patient. I do not ever generalize my treatments. I have to go patient to patient. So treat accordingly. That's my advice to other eye doctors out there as well, that treat it accordingly. Do not generalize it, okay? So that's my summary of normal tension glaucoma. If you have any questions, please ask me in the comment section. In my next video, I will be talking about another thing that leads to glaucoma, or that's the part of glaucoma in many patients It depends. Not every glaucoma patient gets that. It's called pigment dispersion syndrome. So please check that video. It will be coming soon. Thank you so much. Have a great day. And I appreciate your time as well. Have a great day. Bye-bye.